When preparing to handle challenging or difficult customer service occurrences, which of the following is the most effective approach? So now when we have some sort of patient or family member who is very upset, they have some sort of complaint, and it seems like a very heightened situation, the first thing you want to do, what you want to keep in mind, if say these are the flames of anger, we want to try and put them out a little bit, right? We want to just try and loosen it. So just say something or do something to just kind of put them a little more at ease so it doesn't get any worse from this point. Because remember, our main priority in any sort of situation in this profession is safety. And we don't want to lead to a situation that could be worse and put ourselves or other people at risk of harm. So we want to make sure it doesn't get any higher than it is right now, so we keep everybody safe. And then from there, you want to put the patient or whoever you're talking to at ease and try and find ways that you can make the situation better so whatever is bothering them gets resolved. So let's keep that in mind when we look at the choices. So option A says, maintain a strictly professional demeanor. So professional, okay, we like to be professional when we're working with our patients, but avoid any emotional responses. Now, keep in mind here that an emotional response doesn't necessarily mean that you're getting upset or you're showing a lot of emotion. It could be sort of like a human emotion, like a human touch. Like maybe if they're telling you what's bothering them, you show a little bit of empathy in your facial expression, you're nodding. So that shows that human emotional answer to whatever they're saying. So option A might not be the best choice here. So let's eliminate that. Option B says, actively listen to the customer's concerns. So, okay, so far this sounds good. We like active listening, actively listen, while calmly explaining clinic policies. Now, this might not be a good choice either, because if the patient's explaining some sort of situation and why they're upset, whatever it may be, and then what they get in return is saying, well, per policy or office policies, that might not always go with whatever the patient's saying. We don't really know what the situation is here. And sometimes when someone's upset and they just continually hear about policies, they might feel like they're not being heard. They might feel like this isn't really answering what's upsetting them. So this might not be the best option. So I'll put an X for now, but maybe we'll come back to it based on what else we see here. Option C says, immediately apologize for the situation and offer solutions without investigating further. So now here when it says without investigating further, we want to investigate further because in order to best help the patient with the situation that's going on, you want to know a little bit more on what's happening. So this might not be the best choice either. So let's eliminate it for now, but maybe we'll come back. Let's see what option D has to say. And option D says, de-escalate the situation. So that was our first step we said we wanted to watch for, right? Bringing down the fire here, keeping safety in mind. And then from there, we could help to try and make the patient or whoever we're talking to happy. So we're de-escalating the situation, step one, that looks good, by acknowledging the customer's frustration and validating their feelings. And yeah, that sounds good because if we're acknowledging them, validating their feelings doesn't necessarily mean you have to agree with everything they're saying, but you could say, I hear you, I understand that you're upset right now. And then from there, you could try and do something to make it better. But why this is better than, let's say, option C here, is it's saying you're apologizing for the situation without investigating further. So in option D, this is just how you're starting, and then we'll move on from there to best help the situation. So option D is looking like the best choice here. De-escalating the situation, acknowledge the customer's frustration, and validate their feelings.